This video covers surgical ward procedures, focusing on the identification, description, and clinical applications of key healthcare consumables. The nebulizer kit includes a plastic mask or mouthpiece connected to a medication cup and oxygen tubing. This sterile device atomizes liquid medication into a fine mist, mainly used for treating respiratory disorders like asthma and COPD. The endotracheal tube is a sterile, curved PVC tube with a beveled tip and an inflatable cuff for adults. It is essential for maintaining airway patency, mechanical ventilation, and preventing aspiration during anesthesia. Sterile surgical gloves are individually wrapped high-sensitivity barriers, typically made of latex or nitrile. Their main use is maintaining a sterile field during invasive surgical procedures and wound management. The disposable syringe is a single-use device with a clear plastic barrel and volume markings. It is used for the accurate measurement and injection of medications or the withdrawal of fluids. The disposable injection needle is a sterile, stainless steel needle with a color-coded hub. It delivers medications into various tissue layers or is used for withdrawing blood and body fluids. Sterile water for injection is clear, colorless, and pyrogen-free water in an ampoule or vial. It functions as a diluent or solvent for reconstituting dry powders into injectable medications. Lignocaine Gel 2% is a clear, viscous jelly, serving as a topical local anesthetic and lubricant. It is primarily used for urethral anesthesia during catheterization and lubrication for endoscopes. The Foley balloon catheter is a flexible indwelling urinary catheter with 2 ports. It is vital for long-term urinary drainage, monitoring urine output, and managing urinary retention. The urine collection bag is a sterile reservoir with graduated volume markings. It is used for the collection and measurement of urine output from patients with an indwelling catheter. The Ryle's tube is a long, narrow PVC nasogastric tube with insertion markings. Its main uses are gastric decompression, aspiration of stomach contents, and enteral feeding. The IV surgical cannula features color-coded hubs and wings for skin fixation. It provides sustained venous access for fluids, medications, and blood sampling. The infusion set, or IV set, is a sterile system used to deliver intravenous fluids. It includes a drip chamber and a roller clamp for controlled administration of IV fluids and medications. The blood transfusion set is a specialized administration set, similar to an IV set, but featuring a mesh filter. This filter ensures the safe administration of blood components by catching clots and debris. Sodium chloride, or normal saline, is a sterile isotonic solution of 0.9% sodium chloride. Its uses include wound irrigation, hydration, and serving as a carrier for many intravenous medications. Ringer lactate is an isotonic crystalloid solution containing various ions. It is primarily used for volume resuscitation, treating metabolic acidosis, and fluid replacement, particularly in burn patients. Dextrose solution is a clear, sterile solution of purified glucose in water. It provides a source of calories and energy, treats hypoglycemia, and acts as a carrier for IV drugs. Blood collection vacutainer tubes are glass or plastic tubes with color-coded stoppers. They use vacuum pressure for venous blood collection for laboratory testing, including hematology and chemistry. The infant feeding tube is a very soft, narrow-bore flexible tube. This pediatric tube is designed for feeding and medication delivery in neonates and infants who cannot suckle. The oral/nasal suction catheter is a flexible PVC tube with a thumb control vacuum valve. It is essential for clearing saliva, mucus, or vomit from the mouth and nose, especially for patients with artificial airways. The suction tube is a flexible PVC tube or rigid Yankauer tip used to remove fluids. It provides a conduit for negative pressure to clear blood, mucus, or debris during surgery or from the respiratory system. Betadine ointment is a povidone iodine-based antiseptic ointment. It is used for treating minor burns, preventing infection in cuts, and dressing surgical wounds. Lignocaine injection is a sterile local anesthetic solution. Its main uses include local infiltration for minor surgeries, nerve blocks, and epidural anesthesia. The sterile surgical needle is a sharp stainless steel instrument available in various shapes and points. It is a high-precision tool used for tissue repair and suturing incisions. Catgut suture, plain, is a natural, absorbable monofilament suture. It is used for rapid tissue repair in mucosal layers, ligation of superficial vessels, and subcutaneous tissue closure. Chromic catgut is a natural, absorbable suture treated with chromic salts to delay absorption. It is used for internal soft tissue approximation and ligation requiring moderate tensile strength. Vicryl suture is a synthetic absorbable suture made of polyglactin 910. It is commonly used for soft tissue approximation and ligation in general and orthopedic surgery. Black silk suture is a natural, non-absorbable braided thread. Its main uses include skin closure, ligation where permanent support is needed, and drain fixation. Monofilament suture, such as nylon or Prolene, is a smooth, synthetic, non-absorbable suture. It is preferred for plastic surgery, vascular repairs, and external skin closure to minimize scarring. The gauze piece is a white, woven cotton mesh fabric. This highly absorbent material is used for wound cleaning, applying antiseptics, absorbing blood, and primary wound dressing. A bandage is a flexible strip of woven material. It is used for wound protection, applying compression to reduce swelling, and securing primary dressings or splints.